بسم الله الرحمن الرحيم. ان شاء الله النهاردة هنتكلم عن موضوع مهم جدا في الأوبستاتريك. الموضوع ده اسمه abortion and habitual abortion. قبل ما نتكلم عن الابورشن والهابيتوال abortion لازم نعرف ان الابورشن ده one of the causes of bleeding early in pregnancy، يعني من ضمن أهم أسباب البليدنج early in pregnancy. طبعا زي ما احنا عارفين ان في بليدنج بيحصل في الفيرست هاف اوف pregnancy، يعني قبل الفايبيليتي. يعني ايه قبل الفايبيليتي؟ يعني ايه فايبيليتي؟ فايبيليتي معناها قدرة البيبي انه يعيش برا اليوترس. يبقى viability means subsequent potential of fetal survival outside the uterus. فقدرة البيبي انه يعيش برا اليوترس دي بنسميها viability. فهو لو قبل 20 اسبوع يبقى not reaching viability. بعد 20 اسبوع بنقول عليه viable or reaching the viability. الviability دي من ضمن اهم الاسباب اللي بتفرق لنا الابورشن مثلا عن حاجه اسمها الانتي بارتم هيمورج. يعني لو البليدنج ده حصل في السكند هاف او بعد الفايبيليتي بنسميه انتي بارتم هيمورج. لو البليدنج حصل early بنسميه الابورشن. causes of bleeding early in pregnancy من ضمنها زي ما قلنا bleeding early in pregnancy يعني قبل الفايبيليتي. خلاص حفظنا. يبقى اول سبب هو الابورشن، تاني سبب هو الاكتوبيك بريجنانسي، تالت سبب هو الفيزيكولار مول، رابع سبب هو الانسيدنتال بليدنج. والانسيدنتال بليدنج ده معناها bleeding from the genital tract due to a local lesion, due to a local gynecologic lesion in the genital tract. وده بيسبب لنا bleeding early وبيسبب لنا antepartum hemorrhage. يبقى الانسيدنتال بليدنج داخل في ضمن أسباب bleeding early in pregnancy ومن ضمن أسباب الانتيبارتم hemorrhage. يعني ايه incidental bleeding؟ قلنا ده معناه bleeding due to local gynecologic lesion. زي الليجن ده؟ زي cervical polyp، زي varicose veins، زي مثلا cervical erosion and so on. نيجي بقى للموضوع المهم بتاعنا النهارده وهو الابورشن. abortion means بنقول interruption or termination of pregnancy before viability of the fetus. طيب ليه قلنا interruption؟ ليه ما قلناش termination بس؟ لأنه the pregnancy may continue في بعض الحالات. يعني مش شرط إن الحمل ينتهي. يعني مش شرط إن الحمل ينتهي. يعني مش شرط termination. عشان كده بنقول interruption. زي في حالات إيه؟ زي في حالات اسمها threatened abortion. يبقى في threatened abortion بيحصل interruption لكن ما بيحصلش termination. عشان كده دخلنا في definition interruption or termination of pregnancy before viability of the fetus. طيب الانسيدنس قد ايه؟ الانسيدنس about 20%. 20%. Etiology ايه الاسباب؟ في حاجات accidental causes وفي اسباب بتؤدي الى الهابيتوال abortion. طيب نيجي للاكسيدنتال causes. Accidental causes number 1 is abnormalities of the fertilized ovum. وده دايما بيعمل لنا abortion very early in pregnancy. يعني دايما نلاقي الابنورماليتيز بتاعة الفيرتلايزد اوفم بتعمل لي early abortion. trauma as external trauma to the abdomen. hormonal deficiency as progesterone deficiency. some maternal infections. nervous and psychological condition. nervous and psychological conditions. acute fevers. severe nutritional or dietetic deficiencies. maternal anoxia. drugs as quinine and ergo drugs. rapid over distension of the uterus as in cases of polyhydramnios. acute polyhydramnios. There is some causes of habitual abortion. We will discuss it later. Clinical types of abortion. Before discussing the clinical types of abortion, we must put in mind for the diagnosis and to differentiate between any type and the other, we must put in mind some clinical conditions which differentiate each type from the other, as number one, manifestations of pregnancies, if they are present or not. Number two, pain, if it is mild, moderate, or severe. Bleeding, mild, moderate, or severe. The condition of the cervix. The condition of the cervix, whether the cervix is closed or dilated. Passage of fetal parts or fetal tissue. And lastly, the investigation is usually by ultrasound. The first type, which is threatened abortion. Threatened يعني منذر. منذر means that there is threatening in the continuation of pregnancy, and so it is threatened abortion. In threatened abortion, the manifestations of pregnancy are usually present. Pain is very mild pain, minimal pain. Bleeding is also minimal bleeding. The internal os of the cervix is closed by examination, and no passage of fetal parts or fetal tissue, and no rupture of membranes. Ultrasound is here conclusive because it differentiates between threatened abortion and other type, which is very important, which is missed abortion, to detect the viability of the fetus, or the fetus is living or not. So we can differentiate between threatened abortion and missed abortion. The clinical picture is usually confusing, but the only differentiation is to detect that the baby is living. In threatened abortion, you will detect fetal pulsation, fetal cardiac pulsation, but in missed abortion, the baby is dead. The treatment of missed abortion include rest in bed, adequate diet, and we usually support the pregnancy by progesterone. This is threatened abortion. The second type is inevitable abortion. Inevitable means يعني بالعربي معناها حتمي. حتمي يعني the pregnancy will end. In inevitable abortion, the manifestations of pregnancy are usually present, but here the bleeding is excessive bleeding, severe bleeding, and the pain is severe pain. If we examine the patient, we will find the cervix, opened cervix. We may detect the passage of fetal parts or fetal tissue, and usually in inevitable abortion, the treatment is usually to treat shock if it is present and so on, adequate fluid, maybe blood transfusion, and then evacuation of the uterus is the usual treatment. There is a specific type of inevitable abortion which is called cervical abortion. What is cervical abortion? Cervical abortion means that the product of conception left the uterine cavity and distend the cervix. And so the cervix is distended and ballooned by the product of conception. This type is specific with severe pain. Severe pain. Bleeding is considerable, and the treatment is to dilate the cervix and to evacuate it. The next type of abortion is incomplete abortion. Incomplete means that some of the product of conception are still in the uterus and the other part left the uterine cavity. So incomplete abortion means that the sum of the product of conception are still present in the uterus, and the rest left the uterine cavity. There is considerable amount of pain and bleeding, and the usual treatment is evacuation of the uterus to remove the rest of the retained part of conception. The next type is complete abortion. Complete abortion means that all the product of conception left the uterine cavity. The uterus is empty, the bleeding is minimal, pain is minimal, and investigation by ultrasound will diagnose the condition. The next type, which is very important, is septic abortion. Septic abortion means that infection superimposed or on any type of abortion. So, if any type of abortion is associated with infection, the condition will be septic abortion. The infecting organism may be E. coli, beta hemolytic streptococci, anaerobic streptococci, staphylococcus aureus. And the source of infection may be exogenous from infecting instrument, as an example, or it may be endogenous from organisms present in the genital tract. And also, the infection may be autogenous from infecting or septic focus in the patient. Usually, there is headache, malaise, pyrexia, rapid pulse, and the treatment is rest in bed, broad spectrum antibiotic, and for anaerobic infection we give metronidazole, and we isolate also the patient, and when the general condition improve, we evacuate the uterus, evacuation of the uterus. The next type is missed abortion. Missed abortion means that the baby is dead and is retained inside the uterus. So, when the baby is dead and retained inside the uterus, the condition is missed abortion. The manifestations here of pregnancy are declining, minimal bleeding, maybe the patient may suffer from brownish discharge, pain is minimal or absent, usually the cervix is closed, and we reach the final diagnosis in missed abortion by ultrasound. And missed abortion is very important because it has two important complications. Number one, infection may occur and change into septic abortion, and the second very important and dangerous complication is disseminated intravascular coagulopathy and hypofibrinogenemia. The treatment of missed abortion is to wait, because most of the cases we wait for some weeks, about 4 weeks, because spontaneous evacuation occurs in most cases. So in missed abortion, don't hurry to evacuate the uterus. We wait for some weeks because about 4 weeks, because spontaneous evacuation may occur. If a spontaneous evacuation didn't occur, or if there is infection or manifestation, or we are fear from infection, or we are fear from hypofibrinogenemia, we evacuate the uterus. Therapeutic abortion is the next type of abortion, and therapeutic abortion is usually done for medical indication, some medical maternal indications. Non-therapeutic abortion is what we call criminal abortion, which is which occurs in some patients for illegal conditions. We discussed the diagnosis and treatment. Next, habitual abortion. habitual abortion habitual جاية من habit يعني عادة، معناها إنه الأبورشن occurs as a habit for the patient. So, when 3 or more successive spontaneous abortion occurs, this is the definition of habitual abortion. So habitual abortion means occurrence of 3 or more successive spontaneous abortion. Successive spontaneous abortion. Occurrence of 3 or more successive spontaneous abortion, they must be successive. يعني ايه successive؟ يعني consecutive. يعني ايه consecutive؟ يعني بيحصلوا ورا بعض، مفيش normal أو abnormal pregnancy بيحصل between the abortion and the next type of the abortion. And spontaneous means that the abortion occurs spontaneously, not induced. So, when 3 or more successive spontaneous abortion occur, this is the definition of habitual abortion. Etiology. Number 1, chronic general maternal. There are fetal causes and maternal causes as usual. And maternal causes, number 1, general causes, chronic disease as diabetes, as hypertension, chronic nephritis, and so on. Endocrine causes as diseases of the thyroid gland, some maternal infections, immunologic factors. In some condition, there is antibodies which affect the pregnancy outcome. We have important types of antibodies as immunologic factors, which are known as antiphospholipid antibodies. 2 important types are lupus anticoagulant, this is one type, and the second is anticardiolipin antibodies. These antibodies causes thrombosis, and which this thrombus formation and thrombi formation affect the placenta and causes habitual abortion. Marked nutritional deficiency and debilitating diseases, and also psychological disturbances. These are the general causes: chronic disease, endocrine causes, maternal infection, immunologic causes as antiphospholipid antibodies, marked nutritional deficiencies, and psychological disturbances. And in the second cause of habitual abortion, in the maternal causes, are local causes in the genital tract. Local causes in the genital tract as hypoplasia of the uterus or congenital anomalies of the uterus, as septate and subseptate uterus, isthmic incompetence, pelvic tumor, and retroversion flexion of the uterus. And the second is fetal causes. In the local causes, we have hypoplasia of the uterus, which causes abortion in ascending manner, which means that in each time the duration of pregnancy prolong with each abortion. That the duration of pregnancy is prolonged with each abortion. This is specific for hypoplasia of the uterus. Congenital anomaly and septate or subseptate uterus causes habitual abortion, and isthmic incompetence, which is cervical incompetence. It is very important type of important cause of habitual abortion, and isthmic incompetence or cervical incompetence means that the function of the internal os of the cervix is there is dysfunction in the musculature of the internal os of the cervix. This may be organic or may be dysfunctional, and the causes of cervical incompetence may be due to number one, congenital. Cervical incompetence may be congenital, and it may be traumatic, a source of trauma, as rapid, vigorous dilatation of the cervix cause laceration of the muscle of the internal os, and this lead to cervical incompetence. Also, high amputation of the cervix, also trauma to the cervix during labor by forceps or breech extraction while the cervix is not fully dilated. All these cause disturbance in the function, either organic disturbance or functional disturbance of the function of the musculature of the internal os of the cervix, and leads to cervical incontinence. The congenital cause of cervical incontinence occur when there is in utero exposure to diethyl still posterior, and the diethyl still posterior exposure, if the female is pregnant in a female baby, this will result in subsequent cervical incompetence in this female baby. The characteristic picture of cervical incompetence is usually habitual mid-trimester abortion. So, you can reach the diagnosis of the cervical incompetence from the clinical picture of the patient, which is number one, habitual mid-trimester abortion. Number two, the pain in abortion is very minimal. Bleeding is minimal. The abortion is preceded usually by rupture of the membrane. And the baby show no congenital anomaly, and the process of abortion takes a very short time. So, in cervical incompetence, the characteristic picture is habitual mid-trimester abortion. The characteristic here is minimal pain. The baby show no congenital anomaly preceded by rupture of membrane, and that all the process of abortion takes a very short time. In habitual abortion, you can diagnose cervical incompetence by doing in between pregnancy hysterosalpingography, which will show funneling of the internal os, and if the patient also is not pregnant, you can pass number 8 Heger dilator without any resistance. The next is pelvic tumor. Pelvic tumor as fibroid, particularly submucous fibroid. Submucous fibroid may result in habitual abortion, and in rare cases, retroversion flexion of the uterus may cause habitual abortion. Fetal causes are abnormalities of the fertilized ovum. How we can treat habitual abortion? Treatment of habitual abortion. Between pregnancy, number one, we must treat the cause. If the cause is due to antiphospholipid antibody, we treat it. If the cause is due to endocrine cause, we treat it. If the cause is due to local cause as submucous fibroid, we remove it. If there is a septum, remove it, and so on. So the first line of the treatment in between pregnancy, we treat the cause. And then we give the patient hormonal support in the form of progesterone. During pregnancy, rest in bed, good diet, hormonal treatment in the form of supplementation with estrogen and progesterone, and we may give thyroid extract if there is hypothyroidism. We may do surgical treatment during pregnancy, which is the surgical treatment is done to make a suture to support the internal os of the cervix to prevent its dilatation. We do the surgical operation usually بعد الأسبوع ال 12 after 12th week of pregnancy. Why؟ ليه بنعملها بعد الأسبوع ال 12؟ بنعملها بعد الأسبوع ال 12 عشان حاجتين. أول حاجة to be sure that the baby is living. تاني حاجة to be sure that there is no congenital anomaly of the baby. So after الأسبوع ال 12 بنعمل العملية بتاعتنا عشان to exclude congenital anomaly and to be sure that the baby is living. In Cervical operation, we pass a silk or nylon under the mucosa at the level of the internal os. We pass silk or nylon under the mucosa at the level of the internal os and tighten the suture. This is Cervical operation. McDonald operation is a modification of Cervical operation, which is more easier by doing 4 bites in the cervix at the level of the internal os and we tighten them. Thank you.